Algodystrophy is a painful pathology, often really painful, that mostly hits the hands and feet of patients that have suffered from trauma. Today there is new information thanks to Italian research. Let's speak with the author of these studies, Professor Massimo Varenna, responsible of the diagnostic service and treatment of metabolic bone disease of the Orthopedic Institute Gaetano Pini of Milan. Let's start from the news. What is the new element for the cure of this pathology? What is new is represented by the fact that it was published in a studio that worked with a molecule belonging to the biosulfides family, in other terms, neodrenate. From the reasoning of the design of the studio, it was made possible to show without doubt the efficiency of the treatment using these molecules in the cure against algodystrophy. Where was the studio published? This studio was published in an important magazine called Rheumatology, also prestigious ones like Nature Rheumatology, and in this comfort measure the eco that is had at an international level as a result. Can you give us some more information on the trailer? What kind of evaluation took place? How many patients were treated and for how long? The study involved around 80 patients that were studied according to traditional medicine based on evidence. Moreover, a randomized double-blind placebo test. These patients were treated with an originate dosage of 100 milligrams per infusion, meaning injection into the patient's veins 4 times in the arc of 2 weeks, and the parameters for which were investigated were pain, the presence of local inflammatory manifestations, and the degree of disability that this condition can give. For how long was this therapy conducted? The therapy lasted a few weeks. The new information from the studio was going to assert a year later from the treatment the lack of recurrences and maintenance of which was a good result that we observed. Here are the results that we want to synthesize the quality principle that it was. The main result is that these patients in the arc of so little time, let's say a few weeks after the conclusion of therapy, return to using their hand and foot with a slight reduction of what it used to be. The pain and signs of local inflammation tied to algodystrophy tended to disappear parallel to each other. This studio has important characteristics that is just like you mentioned at the beginning of the recording and even by nature of rheumatology. What are the unique elements of this trailer? Substantially, the good result came from the signs and symptoms of the illness, and the duration of which was the period of observation of these patients. These parameters were so convincing that recently the National Association for Pharmaceuticals registered this pharmaceutical for the use in the therapy against dystrophic syndrome. This study didn't arrive by chance, because it began from our profound experience in other Italian centers going in this direction. What has your group done in the past? In the past, Professor Silvano Adami, author and researcher in the use of neodrenate, this type of molecule has already been used in the past treatment of algodystrophy. Both neodrenate administered intravenously and chlordronate, which was used over 15 years ago, famidronate was utilized in different case studies. All these studies in some way successfully demonstrated that these pharmaceuticals were somewhat efficient in treating algodystrophy, even at advanced stages of the illness. What was missing was the fact that the studio gave more than efficiency. It was endurance of the studio and the duration of the follow-up drive, and the demonstration that this therapeutic effect isn't just temporary, but permanent in time.